Hi, I'm Scott Schachter, Vision Source in Pismo Beach, California, and I want to talk to you today again about dry eye disease and ocular surface disease, and really about developing protocols. And a lot of people don't like that term protocol, but when you look at ocular surface disease, in particular dry eye and MGD, I think there's two ways to look at that. You can have a diagnostic protocol that guides your decision making in terms of what ultimately would become your treatment protocol. I get to travel around a lot. I talked to some doctors recently in Ohio, and I came across a guy who was working on a protocol. And if you're watching, you know who you are. And I asked him how long he's been working on his protocol, and he said 2 years, I think it was, or it was going on 2 years. It was about that thick. So in the meantime, he was kind of stuck. And what I would encourage you to do, I mean, what is a protocol? It's a systematic way of doing things. In the same way we run patients through an eye exam, we have a protocol for a workup. So I would recommend picking something. We do signs and symptoms. We do signs with symptoms with OSD. We do signs with zone quick, phenol red thread test, MMP9s, osmolarity, meibography, staining. There's a lot of different ways to do that, but you can keep it very simple. There's a great paper written by, I can't pronounce his name, Christoph Bhagwan, I believe, called Revisiting the Vicious Cycle of Dry Eye Disease. Probably can't see that very well. And it looks at the relationship between MGD and dry eye disease, very complicated. He also wrote a paper called Diagnosing the Severity of Dry Eye, a Clear and Practical Algorithm. And what they narrowed it down to was essentially this: a fluorescein strip and a symptom questionnaire. I use the speed survey. These two things right here allow you to start looking for dry eye on your next patient. You can find the speed survey or OSDI. There's other ones available online. They're easy to find, easy to administer, and I would recommend getting started with something as simple as that. If you haven't started yet, just start doing that. Look for corneal staining and look for symptoms from a patient, and you can go from there. Again, you can get far more complicated than that. When it comes to treatment protocols, that's something I'll talk about next time, and then that's a whole different can of worms to open up. Controversial. Dew's working on that now, in addition to diagnostic algorithms, but I'd encourage you to just get going with it right away. Thanks very much.